All right, the next thing is inflammation focus. Now, this is where I kind of joked about the Advil and Aleve and all, but that really is given a large attribution of why people hurt, and it's proposed to most people who have pain. I mean, think about it. When you go to see the doctor for a shoulder, knee, back, whatever, what usually happens? They usually do some form of imaging. They do a physical exam, pretty brief sometimes, just because the way our healthcare system is. And what do? They prescribe you medicine, don't they? Typically with musculoskeletal, it's anti-inflammatories. Well, not all pain is inflammatory pain. This is based on the assumption that the pain is due to the inflammatory response, but the inflammatory response has a very distinct background or history. A patient describes a similar thing. Recent onset. If it's in the arms or legs, there's typically swelling, fever, it's warm to touch, redness, pain, and loss of function. Now think about all of your pains. How many of them fit that? Are you red and swollen? Is there smoke? Okay, there's no smoke, and they're not recent onset. Most of us have been dealing with what we're dealing with for a while. The body does not just start a perpetual inflammatory response and stay in an inflammatory response. You walk on the side of the sidewalk and sprain your ankle, what happens? It blows up. And if you go see a doctor, what will you say? I did it yesterday or 3 days ago, not I did it back in 2021, and ever since then I've hurt. Okay, that the body doesn't just start an inflammatory response and stay in an inflammatory response. It's designed to be a very short phenomena, and then we work into other forms of pain. So if you got pain and it's not recent onset and doesn't have these characteristics, very low likelihood that it is inflammatory dominant pain.